everybody. Thank you very much for being here at Manatt Community Health Center in beautiful downtown North Quincy. We very much appreciate your presence here. I'm here joined today by fellow board members, Linda Kelly and Joe Reardon, who is over here. And so we're delighted to be here today to talk to you about Manatt and to welcome our congressional delegation here to sponsor Community Development Block Grant Week. We have been the wonderful beneficiaries of community development block grants over the years, and most recently, we were very fortunate to receive a $750,000 grant for this beautiful new radiology suite. And with this radiology suite's opening, it represents a return to Quincy for radiology services that has not been available for the past decade. So we're very pleased today to have a group of people here to tell you more about community development block grants than I can. But first, I would like to introduce you to Cynthia Sierra, who is the CEO of Manatt Community Health Center and really has been the leadership behind tremendous growth that Manatt has seen in the past year. Cynthia.
Thank you. Thank you, Grace. Thank you for your good governance. And I consider healthcare and community health centers a team sport. So in this spirit, we welcome you here today. Second to welcoming our patients, it is such a pleasure for us to welcome our partners and community. And just what a wonderful day. Our mammography suite, our x-ray suite, some breaking news as of yesterday. The radiology technician has been hired and she will start in the middle of May. So what a watershed event for us. Absolutely, absolutely. So thank you. We are one step closer to opening and providing mammography, screening mammography and screening x-ray for our patients and for members of the community. There's certain gates that you have to pass to be able to have a world-class radiology center for your patients in the community. And those approvals, including the Department of Public Health, we can check that. Our application is in now with our hire to the American College of Radiology and then the U.S. Food and Drug Administration, FDA. So know that what has been built here by Marsha Mead and our expansion partners, South Coastal Improvement, will be just state of the art, and we cannot be happier about that. So National CDBG Week, an important week for us. We're honored to be able to be a host site for it, and we're grateful for the partnership that we have, and particularly for our friend and colleague, Sean Glennon, who directs the Community Development Program for the city in Quincy and the Planning Department so very well. So without further ado, I'll turn this over to my dear friend and colleague, Mr. Sean Glennon. Thank you.
Thank you, Grace and Cynthia. Thank you to the entire Manatt team for your hospitality today and for your patience, partnership, and perseverance on this magnificent project. And thank you all for being here today. This is National Community Development Week. It's an initiative of the National Community Development Association, or NCDA, of which Quincy has been a longtime member. And it's a time when communities across the country come together to celebrate the good works and positive impacts of the Community Development Block Grant Program and other entitlement programs that are funded by Congress and administered nationally by the United States Department of Housing and Urban Development's Office of Community Planning and Development. Several members of our community development team are here today. Joyce Jang, Jane Berry, Paul Gould, our manager of accounts. Melissa Pond is our public services coordinator, our CD Week calendar coordinator, our CD Week social media coordinator, and also assists our national office of NCDA with the CD Week toolkit each year. And I also see Sherry Zoe, who's here, who is our manager of housing programs and our grants compliance officer. Sherry has been my right hand on this project, and she's amazing when it comes to the cross-cutting federal requirements that are triggered by projects like this, from environmental review to prevailing wage, and the list goes on and on, including procurement. And Sherry's the one that really keeps us out of trouble with our friends at HUD when it comes to especially larger projects. So Sherry, thank you so much for your partnership. I also want to recognize Jim Fatsis, our Director of Planning and Community Development, for his support and our involvement with NCDA. Jim's encouragement not only keeps the staff motivated, but makes us excited to come to work every day. So Jim, thank you for your support. CDBG began in 1975, and as of this coming July 1st, Quincy will have received over $100 million in CDBG funds since that time. Locally, CDBG is used for a wide variety of projects, including social services programs, housing rehabilitation, infrastructure improvements, economic development, and of course, public facilities projects like the one we're celebrating today. And looking around this beautiful setting today, it really reminds me of what CD Week is all about, bringing people together and celebrating the tremendous accomplishments that we have made in providing a better quality of life for our neighbors. Now, I've had the honor and pleasure of serving as a city CD director for almost 11 years, and I've worked for the department for over 18. And I've attended a many number of groundbreakings, dedications, and ribbon cuttings, and I can honestly say that none of them have had a more profound impact on me personally than this celebration today. And there are two reasons for that. Their names are Brian and Michelle Glennon, my parents, who passed away this past winter within 57 days of each other. My dad in early December, and my mom in late January. My dad served honorably in the U.S. Air Force. He was a Vietnam-era veteran, and he was a patient at the VA clinic right here. He lived just a half mile down the street as the crow flies, and he used to rave to me about how convenient it was for him to be able to just drive up the street to receive primary health care services, not have to go to the VA in Jamaica Plain or in Brockton. He also lauded the quality of care that he received here. And Congressman Lynch, I know my dad appreciated your advocacy on behalf of veterans across the country with respect to VA health care. And Mayor Koch, I don't know anyone that has done more for our veterans locally than you have. As for my mom, she was not a patient here, but she is connected to today's reveal through one of the pieces of equipment that is now on site. In the fall of 2003, my mom was diagnosed with breast cancer. As I mentioned a few minutes ago, she just passed away in January, so that's 20 years after her diagnosis, which means that she was a longtime breast cancer survivor. And that is thanks to early detection from mammography equipment that is similar to the equipment that is part of this radiology suite. And to think of the lives that may and will be saved through the work that all of us have done together in making this vision a reality is truly a deeply humbling and incredibly powerful experience. As I mentioned earlier, the CDBG program is administered nationally by the U.S. Department of HUD's Office of Community Planning and Development. Each grantee community is assigned a HUD CPD representative who is responsible for reviewing our annual action plans, our annual reports, conducting routine monitoring, and serving as a liaison between the community and HUD. Our CD rep for our entitlement programs is Cindy Lopez, and she has been a regular fixture of our CD Week events over the years. Unfortunately, she reached out to me this morning and said she would be unable to attend, but nonetheless, I want to publicly thank her for her advice and counsel over the years, and Bob, I hope you'll take that back to the office. And when Cindy completes her review of our annual plans, it's our next speaker who provides and executes the grant agreements that we receive to fund these projects. Bob Shimeko is the director of the New England office of CPD, which covers virtually all of New England. Bob has held this position for nearly 14 years, and during that time, he has really emphasized his philosophy that the CPD office should be an engaging and supportive partner of grantee communities rather than simply a monitoring and oversight agency. And indeed, during his tenure, communities like Quincy have engaged and completed a plethora of innovative initiatives that I'm not so sure would have happened without his insightfulness and passion for the programs that his office administers. And so with that, I please ask you to join me in welcoming Bob Shimeko.
Good morning, everybody. On behalf of Secretary Fudge and my regional administrator, Juana Mateus, I really want to say thank you to certainly the congressman and also to the mayor. It's wonderful to be here, and I want to tell you first of all that my HUD secretary, I've been here working for HUD for it's a little over 20 years, is the I think most passionate and most down-to-earth HUD secretary that I've ever had, and that goes for this administration. And I think it's important for me to say that because they're just that passion. I think results in what we're seeing today. And really, I also want to really thank the congressman for his unwavering support for our programs. The entire congressional delegation, they've always stood beside us. I sound a little nervous because I'm a passionate guy, and this is a great week for me because I get to get out in the field. I get to see things. I get to press the flesh. I do it anyway, but it's sort of like condensed. And after the 2 years of the pandemic, and I think the pain that we went through, it's wonderful. And so my job today is to not cry. I'm one of those guys that and I didn't make it through. I was down in New Bedford. I saw a couple things, and then I speak and I want to talk about the great work. But I think the thing I really want to emphasize is a partnership. Sean is a great person, a great friend. We walk the line of compliance. We're public trust officers. We provide grants. And my job is that I'm the good guy because I have a job where we give out a number of different grants that Congress has created, these different programs, homelessness, the Community Development Block Grant, which can do everything. I was talking about how we can pave roads, we can do sidewalks, but really it's about community and the effect that we have on people. And I always, I just mentioned before about small C and big C community. And it's about trying to make a difference and trying to really improve people's lives and the quality of life. And projects like this, they are so wonderful because you're really talking about people's lives, and I'm a public servant, and I had my own business many years ago, and I liked that, but it was the thing like, well, all right, so you can't pay, all right, I'll reduce the price, and things like that. But I got into this public service because I love helping people, and I think that the key on Community Development Week, National Community Development Week, about the block grant program, is that this is the type of program that you can do a myriad of different things with and be very successful. But really it's about the on the ground, someone like Sean and the support of the mayor, the creativity, to think of, this is a hard project to do. This is very difficult. The pieces of the puzzle to put together. It sounds easy, right? You get a grant, but no, there's all these regulations and all these things that we impose and all the work that goes in on the ground. And as I said, it needs leadership support, like the mayor and the congressman, the council. It's a hard road, but when you see the fruition of something like this and the effect that it will have on people, on individuals, and on families, it makes it, it makes it all worthwhile. And I really want to thank certainly the organization. I want to thank the city for their, as I said, unwavering support for our program. And it's just, I want to thank all of you for inviting me here today and to really, get the warmth of what public funding can really do. And I think the important piece that Sean alluded to is that the message that there is a reason why, we have federal funds and why it's about a partnership between the city, the state, the local government, and those nonprofits and the general public. And this is the result of that partnership. And I really, once again, want to thank the hard work that everyone's done. Thank you so much.
Thank you, Bob. As has been illustrated so far today, projects like this don't just happen overnight, and they certainly don't happen by accident. They need people, they need time, they need money, and they need political will. And Quincy is extremely fortunate to have elected leaders such as Mayor Koch and Congressman Lynch. I remember in the early days of the pandemic, in fact, it was just 1 week after Governor Baker's executive order, state of emergency declaration, that Mayor Koch had me and Jim into his office to discuss a multifaceted, rapid response to addressing the impending crisis. The mayor directed us to develop an emergency small business grant program, which ultimately assisted 377 mom and pop shops in Quincy, many of which would have gone out of business permanently without that program. At the mayor's request, we also developed an emergency housing program for local workers living paycheck to paycheck. And during that meeting, the mayor also asked us if we could provide additional funding to food pantries that we had already provided funding to for the year. Unfortunately, as Bob knows, the CDBG program has a cap of 15% on public services, which is the category that we use to fund the food pantries. And I told the mayor that it would take either a waiver from the HUD secretary or literally an act of Congress in order for us to be able to provide additional funding to those agencies. And the mayor said, well, I'll be speaking to Congressman Lynch this afternoon, I'll mention it to him. And it wasn't long after that we received a letter from our friends at HUD notifying us that the public services cap was being temporarily waived nationally. And that gave us the opportunity to fund those centers more. And it was exactly 1 year ago today that we held our last CD Week speaking program with Mayor Koch and Congressman Lynch. It was an event at Quincy College highlighting the investment of CDBG stimulus dollars that went into a suite of 8 workforce development programs for unemployed and underemployed individuals. Thanks to the mayor's bold vision and the congressman's steadfast advocacy of our entitlement programs, we assisted nearly 7,000 Quincy residents through public services during the last program year. We rehabilitated dozens of homes, including lead paint abatement, and we provided $250,000 in matching funds to the Point Webster School recreation project, and we worked with local nonprofit housing organizations to create, maintain, and preserve affordable housing units. I, for one, am extremely grateful to both of you for your leadership in providing a better quality of life for our residents. And so at this time, I'd invite Mayor Koch to provide some remarks, followed by Congressman Lynch.
Thank you, John. I get the best job in the world because I get to work with people like you, people all around here. I mean, Manet is, Cynthia and Grace, one of my favorite nonprofits to work with. First, because of your leadership, but also what this place is all about and how people benefit from it. The healthcare network has been a challenging crisis for some time now, but the local healthcare centers really meet people where they're at on the ground in the neighborhood. So thank you for your great service. Obviously, we're delighted about what's happening here today. Sean, you do remarkable work with Jim and the team at the planning department. I've never known us to be in trouble with any kind of an audit. I know there's times where I might push a little hard. Sometimes I'm looking for the gray area because sometimes it's frustrating with all the rules and regs, but you always find that way. And I know that's in part because of the relationship we have with you, Bob, and it's not one of punitive, it's one of, okay, how do we find out to get there? And of course, having this congressman who's got his feet on the ground, he's got his, he gets it, he knows his district, he knows his community, he knows the city. So when I have a conversation with him, I don't have to explain anything to him because he gets it, he understands it, he knows the issues. And that whole crisis you alluded to, Sean, with everybody coming together, working hard, it was that conversation. We're always grateful for the work he does with all the CDBG work, with all of the federal programs, the CARES money, the ARPA money, and I'm glad to spend it, Congressman. Keep it coming. We'll make good use of it. But it is that ability to be pliable and adjust, particularly under very difficult circumstances, where at times government can be very rigid with the rules and regulations. But it really, when you look back at that time period, it was remarkable how everybody really came together to make it happen. It was all about public safety, public health, and no egos get in the way. It was a case of let's get it done, let's get it done. So for that, I'm always grateful to the congressman because we just have a great relationship. And we honored Charlie Baker the other night, and Karen Polito, Lauren Baker, and the Baker administration for very similar things at the state level. And it wasn't about Democrats and Republicans the other night. It was about getting things done for the people we serve. And there's no better guy than Congressman Lynch. Bob, I want to wish you well with the marathon. Thank you. Anytime I get the urge to go out for a run, I lay down until it goes away. I don't know what the weather looks like on Monday, but it's going to be good. Good. I wish you well. And with that, I'd like to introduce a guy that doesn't need introduction. That's our dear friend, and I say that he's our dear friend for our district, the great Congressman Steve Lynch.
Thank you. Thank you, Mr. Mayor. Great to be here. Again, I want to thank Cynthia and Grace and Sean and Bob Shumako. Thank you for your... This is hard. It is hard work. I'm glad Bob, seized upon that. They think, okay, we got $700,000 from the federal government. It should be clear and easy. Anybody who has had the misfortune of having to fill out a SAMHSA grant that's about this thick, and they want to know your entire history for the past 50 years before you can get any federal money. But thankfully, we have a great team here that works together. We're able to get it done. But every team needs a quarterback, and our quarterback is Tom Koch. And I know, and the Appropriations Committee in Congress knows, that if we give Tom Koch $1, we get $5 in services. He has a multiplying effect on the good work that Congress can do. And whether it was the CARES Act, and I want to join with the mayor in giving Governor Baker and Mary Lou Sutters, the HHS secretary at the time, great credit for putting politics aside and just trying to get done what needed to get done on behalf of the people who rely on us every single day. I'm also blessed to have 3 VA hospitals in my district. So I have West Roxbury, I have Brockton, and I have Jamaica Plain. I spend a lot of time there with Vincent Ng and his staff in terms of trying to steer resources, but I am so pleased that there's this partnership between Manat Health Center and the VA, as well as a 340B pharmacy here, because so much care, absolutely. The old model of healthcare used to be hospitalization. That is not where we're at anymore for any demographic. For seniors, we're trying to care for them at home. We're trying to keep people out of the hospital, and that is accomplished by some of these groundbreaking drugs that we've been able to fund and develop. And we're in the midst of that right now. So many companies, from Siemens and Walpole to Ginkgo Bioworks and Vertex on the South Boston waterfront, there are new drugs that are coming out every single day. I do want to talk about the work here, though, the work. And since Quincy Hospital closed down their mammography unit some time ago, we have been without those services. So being able to reinstitute the practice and the availability of mammography is so important. And Sean talked about his own family experience, my family experience as well. My mother-in-law Helen lived with us for about 30 years. She was a Gold Star sister. Her brother Arnie was killed in a jump over the Rhine in 1945, in May of 1945. And so she was a Gold Star sister. She was thankfully diagnosed very early with breast cancer through a routine mammography. Lived another 30 years after treatment, after mastectomy, but lived to the ripe old age of 95 and loved it and was productive and loved every day. So that was such a gift. But it was because of the health. My wife works at the South Boston Community Health Center, so I know way too much about health centers and the work that they do every single day. You've got a built-in lobbyist in my house, so I really have no choice, Cynthia. But it was the fact that it was drilled into my mother-in-law that you got to go for this, so as she got older, they became more frequent, but her mammograms and checkups, and that is such a gift. And the fact that we're going to be able to do that again here, and people won't have to travel, and as Sean's dad said, it's just so great that it's so convenient. You don't have to, drive to I love the VA, but having to drive down to Brockton, that's as you get older, you got to rely on people to get you there, and it can be a hassle. So having it right here in the community, what's better than that? And so I just want to thank my partners, especially Mayor Koch. Like I say, this is my 4th event in Quincy this week, and it's because of you son of a gun. All of the work that you're doing, whether it's for our veterans, whether it's for housing, whether it's for the health center, whether it's to honor our veterans and say thank you to Governor Baker the other night. That was a wonderful event, and it was perfectly done. That all goes to the team that we have here in Quincy. It really does. We have a wonderful state delegation. We have a wonderful city council. They do great work. But like I say, we need a quarterback. And frankly, I'm in Washington 4 or 5 days a week. So I rely on Tom Koch, principally, to tell me what Quincy needs, what are the top priorities. And thankful for all of us, Tom Koch identified Manatt Community Health Center and the VA outpatient clinic here as his top priority. So my thanks to you, Mr. Mayor. My thanks to the entire team. It's an honor for me every single day to represent the wonderful city of Quincy, the city of champions, the city of presidents here in the United States Congress. So thank you very much.
So one of my favorite parts of CD Week is to give out awards. It's a great way to recognize our partners. And the highest award that we have each year is the Mayor's Community Service Award. And we didn't have one last year because our main event was a little unique, which meant we could give out 2 this year, which is perfect because the staff nominated 2 individuals. And when I mention who they are, you'll understand how impossible it would have been for us to choose between the 2 of them. And they are in great company because a couple of former Community Service Award recipients are with us, Cynthia and Congressman, who received this award in recent years. And so I would ask Grace and Marcia to please come forward for me. I will read these and I'd ask the mayor to present them to our recipients. So, the Mayor's 2023 Community Service Award is presented to Grace Murphy McAuliffe. In recognition of your decades-long community service to the city of Quincy and throughout the greater Quincy area, your leadership as president of the Board of Directors of Manatt Community Health, Director of Finance Administration and Leased Housing for the Quincy Housing Authority, and President of the Quincy Park Conservancy, has provided health care, housing, and enhanced open space access to thousands of Quincy residents and to others throughout the South Shore. The City of Quincy is grateful for your service to our residents and to the patients of Manatt Community Health Center.
Thank you. Thank you very much. I'm absolutely unaware of this. Thank you all very much. Thank you, Mr. Mayor. Thank all of you for this honor. It's really an honor to serve this community. So this is greatly appreciated. I will hang it in my office at work, but very much my honor to serve the community. So thank you.
And the Mayor's second 2023 Community Service Award is presented to Marcia Mead in recognition of your tireless devotion to Manatt Community Health as its Director of Physical Sites and Design. You have fostered positive and enriching relationships with health center stakeholders, vendors, and community partners, all of which have improved the quality of life of Quincy residents and of those throughout Manatt's far-reaching service area. Your dedication to community service is a model for others to emulate. Congratulations.
Thank you.
Thank you. I'm honored to work here. I love what I do. I'm grateful to Bill and whatever I can build to help the community. Thank you.
Thank you all again. I'll turn it back over to Cynthia.
Absolutely. Just really quick, what a wonderful opportunity to honor and recognize Marcia and Grace. We're going to start some tours. So Marcia will lead the way. Sandra McGonigal will support. Come and see our X-ray and our mammography suite. Enter the building. We're going to take a left. So thank you. Thank you so much. Thank you.